Let's talk about mood stabilizers now. Okay, mood stabilizers. So here I will write the drug, here I will write the indications, here I will write the side effects. Very important. Mood stabilizers. Okay, let me check once. Okay, first drug I will take is your lithium. Correct, lithium is your first drug. So indication, actually it is your first line mood stabilizer. Remember, first line mood stabilizer, it is used for acute mania, right, in combination with other antipsychotics. Okay, so in acute mania, lithium is used in combination with other antipsychotics, and again for prophylaxis of BPD. BPD is borderline personality disorder. Also it is used for augmentation in depression treatment, right, in augmentation, right, not for plain depression, for augmentation cases. Also it decreases suicide risk. So if they ask, 1 minute, I will write separately. This is a separate question, just note it here, that there are two drugs that will decrease suicidal risk. One is your clozapine, okay, or we can say two drugs with anti-suicidal property. One is your clozapine, second is your lithium. Correct, don't forget, very important. Two drugs with the decreased suicidal tendency is your clozapine, lithium. Okay, now that was your uses of lithium. Now coming back to your side effects of lithium. First, of course, is your thirst, then polyuria, correct, diabetes insipidus, tremors. Now remember, tremors are coarse when lithium toxicity is on the higher side, right? When there is lithium toxicity, we will get coarse tremors. Otherwise there is fine tremors, right? Then weight gain, then hypothyroidism, right, all this you know, hypothyroidism, then nausea, right, then diarrhea, then seizures important, right? Okay, teratogenicity in first trimester. Okay, then because there is which teratogenicity, actually it is good, this is abstinence anomaly. Okay, abstinence anomaly. And acne, vomiting, right? So it is a narrow therapeutic window, lithium, right? So actually it is 0.8 milliequivalent per liter is used, but however you can use 0.8 to 1.2 in case of prophylaxis, but don't go beyond the range of 1.5, because more than 1.5 milliequivalent per liter is your unit. This is your lithium toxicity, more than 1.5. okay, so there it will, in case of toxicity, the presentation will be dysarthria, delirium, even acute renal failure. Okay, avoid lithium in patients with decreased renal function or with renal compromise, because of the toxicity is acute renal failure, right? So avoid lithium in patients with decreased renal function. So I hope this one is clear. Again, I will make a table: drugs, indications, side effect. Next mood stabilizer is your carbamazepine. Now carbamazepine is a second line mood stabilizer. Also it is an anticonvulsant. Also it is used in trigeminal neuralgia. Remember, okay, so it is an anticonvulsant used in trigeminal neuralgia and a second line mood stabilizer. Side effect is your nausea, skin rash, then leukopenia, AV block. Neural tube defect is your teratogenic effect, then aplastic anemia rarely. Most important, Steven-Johnson syndrome, right? Most important is Steven-Johnson syndrome, neural tube defect, right? Leukopenia, right? Neural tube defect, Steven-Johnson syndrome. Remember Steven-Johnson syndrome, okay, always. Okay, next drug is our valproic acid, or we can say valproate. So here the indication is your BPD, and it is also used as an anticonvulsant. You know, BPD is your borderline personality disorder. Good. Side effect is your GI side effect, mainly nausea, vomiting, tremor, then sedation, right? Alopecia, hair loss, weight gain, teratogenicity as neural tube defect. Okay, then pancreatitis, thrombocytopenia, hepatotoxicity, granulocytosis. All these are side effects of valproic acid. Last I will talk about the not the least one but the last one. Okay, lamotrigine. This is second line mood stabilizer, also is an anticonvulsant. Here these side effects come as blurred vision, GI distress, right, rashes, again Stevens-Johnson syndrome. Okay, so we found Stevens-Johnson syndrome as the side effect for lamotrigine and carbamazepine, and lithium has the side effect as abstinence anomaly. However, the risk of abstinence anomaly is 0.1% in case of lithium, right? 0.1% only. So it is more fear than risk. Anyhow, just remember all these drugs. Okay, it's a very important drug list. So let's revise once again. Okay, so first drug is our lithium, which is the first line mood stabilizer used in acute mania, BPD, or augmentation in depression treatment. Side effects being thirst, polyuria, diabetes insipidus, tremor, weight gain, hypothyroidism, nausea, seizures, abstinence anomaly, acne, vomiting. It is a narrow therapeutic index. You can use it 0.8 to 1.2 milliequivalent per liter. When you use it more than 1.5, there comes lithium toxicity, where there will be codes, tremors, ataxia, dysarthria, delirium, acute renal failure, and you must avoid it with patients with compromised renal function. Two drugs that decrease suicidal tendency are your clozapine and lithium. Okay, next drug I discussed about carbamazepine, which is a second mood stabilizer and second line mood stabilizer, which is anticonvulsant and also used in trigeminal neuralgia, and the side effects being GI, this one, nausea, skin rash, leukopenia, AV blocks, neural tube defect, aplastic anemia, most importantly Stevens-Johnson syndrome. If we talk about valproate, it is used in BPD and anticonvulsant as also. Side effects being nausea, vomiting, tremor, sedation, alopecia, weight gain, teratogenicity, pancreatitis, thrombocytopenia, hepatotoxicity, agranulocytosis. And talking about lamotrigine, is the second line mood stabilizer and also an anticonvulsant. Side effect being blood vision, GI distress, Stevens-Johnson syndrome, right? So revise these drugs.